Let's go ahead and jump on in. So welcome everyone. We are so excited that there was so much interest in this topic and talking about this today. We had a lot of people register for this, and we're also recording it. So if you want to share it afterward, people weren't able to make it or anything, please feel free to do so. So we'll start out with introductions of the panelists. So I'm Beth Dauber. I'm a project coordinator with the University of Missouri, Kansas City's Institute for Human Development. So that is the USED for Missouri. And I will pass it to Russha.
Good morning, everybody. My name is Russha Knauer, and I'm the director of the MindSource Brain Injury Network here in Colorado. Maria?
Hi, everyone. I'm Maria Crowley, NASHIA's Director for Professional Development. It's a pleasure to be here.
I'll go next. I'm Haley Cushion, NASHIA's Director of Program Management, and I'm here on behalf of the membership program today. Jill?
Good afternoon, everyone. I'm Jill Darty. I'm the director of NASHIA's new Innovation Center. For those of you who haven't heard about the Innovation Center, we are aiming to develop and implement research-based service delivery models and maintain a national repository of information to improve systems of care. And one of the Innovation Center's focus areas is intimate partner violence. So I look forward to collaborating with this special interest group as we build out our IPV-related research agenda. Becky.
Great. And hi, everyone. I'm Becky Wolfkiel. I'm NASHIA's Executive Director, and so pleased that you're joining us today to learn more about this new initiative.
All right. And I just want to have a reminder that we are in webinar format today. So please feel free to use the chat, which I see you guys have already been using, because there will be some discussion components. So that we have the chat, we have the Q&A. And then if you wanted to say something or come off mute, just raise your hand and we can allow you to come off mute. All right, so here's an overview of what we're going to be going over today. So we're going to start out with some introductions and a welcome from NASHIA. We're going to talk about the background of the IPV, Intimate Partner Violence SIG, or Special Interest Group. We're going to talk about the now what, current knowledge and gaps around intimate partner violence and brain injury. We are going to have some group discussions really around priorities and what you guys are seeing in your states, and then kind of address some next steps. So we're going to jump into introductions. So just so we have an idea of who's in the room and that we can kind of get to know each other as well. So in the chat, if you could please add your name, your state, your organization. And we're also well aware that IPV brain injury is a heavy topic. So we wanted to kind of start out with something a little bit lighter. So if you could also add in a number for which squirrel you identify with today. So if you guys could just take a minute and add that in. And while you guys are doing your introductions, I'm going to introduce the poll. So this will be our first poll. And we just kind of wanted to be thinking about why you may have joined us today. So we know that there's a lot of priorities, there's a lot of meetings, there's a lot of things that are happening, but you took the time to come to this meeting. So we have identified 3 options. So first being you're just kind of curious about the SIG, maybe gathering information, seeing what this is all about. You are excited and already ready to join the SIG and you want to sign up right now. Or maybe somebody else told you to come. Either not sure why you're here or just kind of gathering information to take back. So if you could finish your introduction and then choose one of those options.
Hey, Beth, you might want to pop back a slide for a second because I think people forgot which squirrel was what.
Oh, they forgot which squirrel? Okay.
Yeah, thanks.
What about our panelist? What squirrel? I feel like I am maybe like an 8 because I've been thinking about this meeting for a while now, and I'm like so excited that we're here and we're talking about it.
I go back between an 8 and a 4 because yes.
Spooky season is among us, so I could see some
Right.
fours.
Is it spooky season or is it pumpkin spice latte season?
I'm a 9 because I love corn, and if you know me, you know that about me.
I'm always an 8.
What's number
Oh.
7 doing?
I don't know.
Studying.
Becky, you were saying you're always a what?
An 8. I'm always an 8.
Beth, can you see the results of the poll?
I can. So it looks like a majority of you guys are curious about the SIGs. So kind of just taking it all in and seeing what it's about. And then second, being excited to join. So we had 17 people who are already ready to sign up, which is awesome. And then we had a number of people who are learning for others. So awesome. Well, thank you for that. All right, so we are moving right along. I am going to, so just so that everyone's aware, although Colorado and Missouri have come together to co-lead this group, it is still very much hosted by NASHIA. And so NASHIA is supporting us with these efforts. And so I'm going to have Becky and Haley talk a bit about the organization.
Great. Thank you so much. And I just have to say, when I was told I was following the squirrel scale today, I wasn't quite sure what that meant, but I love the squirrel scale, and I think we should start to integrate that into all of our meetings. So thanks everyone for taking some time this afternoon to join us. For those of you who I don't know, I'm Becky Wolfkiel. I am NASHIA's Executive Director, and I am delighted to be joined with my team and Beth and Russha today to talk about one of our newest efforts, which is our IPV SIG, Special Interest Group. And I think, seeing the chat and the attendees and the diverse range of people that are joining us, I see many of you who have been familiar with NASHIA and been engaged with us for many years, and I see some newer folks as well, and I love that. NASHIA continues to create new opportunities to support states and their partners. We're really committed to strengthening service delivery systems in every state, regardless of what currently exists, and trying to meet folks where you're at. And one of the things that we know is most important is an opportunity for dedicated individuals who are interested in making change in a specific topic area to come together, share best practices, and support one another. And when Russha and Beth approached our organization and mentioned that they wanted to create this special interest group, it was really a no-brainer for us to say, yes, this is an area of interest to our states. It's emerging still. There's a lot that we need to learn from one another. And it's important that NASHIA be the conduit for that information exchange and support. So I just want to thank Beth and Russha for leading this effort. I think it's really important. I'm proud that our organization is associated with it, and I'm very excited to see what results emerge from the collaborative by the end of the year or next year, I guess, at this point. So anyway, thank you for all of you on the Zoom line. Please reach out to any of us if you have any questions. This is a team effort, and we're all here to support it. So I'll turn it over to Haley now for some more thoughts.
Thank you, Becky. As we are so excited to welcome this new special interest group to NASHIA, it is very important to know that it is a member-only benefit. As we love everyone in the brain injury community, we do offer some special exclusives to our members. And in addition to participation in special interest groups, for members, you also have access to regional networking meetings, which is a huge member benefit to connect with those neighbors across state lines that are doing work in the area that you are. We also have the ability to increase your leadership skills and your participation in the community through membership in some of our committees. You also have access to NASHIA's network of experts, our membership directory, which can put you in touch with any other members nationally. We have discounted rates for any of our fee-based events, such as our Seed Summit, which happens every 2 years in DC, and also our annual conference that happens all over. And it just so happens that next month is going to be in Portland, Maine. We're going to have a couple special tracks, and one on behavioral health and another on criminal legal system, in addition to all our wonderful content on brain injury in general. So please do check that out. Members also get free certificates of attendance to our webinars that are free and open to anyone. And then we also get special rates on some of our training new programs that are fee-based. In addition to that, members get a member-exclusive weekly communication from us that has a lot of insights into funding and resources and programming that's specific to the brain injury community. So we would love to have you as a member. And if you can show the next slide, I'm going to tell you a little bit about our membership categories. We have a couple group memberships, which are mostly for like organizations to host several members or several team members within an organization. We have them available to state agencies and universities. We have them available to state brain injury advisory councils. And we also have them available to supporting organization. Membership is available to nonprofit and for-profit agencies where you get additional member benefits and multiple members. We also do have some individual memberships. Next slide, please. If you are a state or university employee, you can get an individual full membership. There's a state retiree membership. Also, most people that aren't a state or university employee fall within our individual associate membership, which is just, of course, for one. But it is available for kind of our catch-all for anybody that doesn't, qualify for the retiree or the full membership. I'm going to put my email in the chat if you're interested more in membership and what it does cover and the benefits. Please do let me know. I'd be happy to set up a call or chat or just email back and forth about some of the benefits. And with that, we would love to have you as a member because it would allow you to be in this new collab we've got going on with IPV, with Beth and Russha, but also give you more of a connection to the brain injury community.
Awesome. Thank you so much, Haley. All right, we are moving on, and Russha is going to talk a little bit about the background and kind of how we got here.
Awesome. Thanks, Beth. I am really interested in running a special interest group alongside with Beth and everybody who decides to join to talk about brain injuries across a system of intimate partner violence. And it's really important, and it's a cause near and dear to my heart for several reasons. One is that we know pretty well from lots of research, both locally and nationally, that people who are survivors of domestic violence have very high rates of brain injury, both traumatic brain injuries and non-traumatic injuries. Studies have shown that anywhere between 40 and 92% of people are living with a brain injury if they've been involved in a violent relationship. In Colorado, we actually have one study site that shows it was upwards of 97% of women are living with brain injuries, and those are women who were sentenced to some sort of formal supervision, but the commonality amongst all of them is that they were involved in violent relationships as well. We also know from other national research that at least 75% of women are living with a brain injury, and of those, half of them have experienced multiple repeating brain injuries, and that's so important. And the reason that that's so important is because we know that if you're living with compounding brain injuries, your trajectory and your care looks much different than if you've had one brain injury. We also know that that's really important because if you have had multiple compounding injuries in a short amount of time, you haven't had time to rest and repair from those injuries. And so your day-to-day life looks much different, and the care that you require and that you'll benefit from should adapt to meet those changing circumstances. And then we also know that people who are living with a brain injury caused by domestic violence often do not go and seek medical care. And because they don't seek medical care, they're not properly diagnosed, and they don't receive the care that I was just talking about that is so necessary to help them recover and learn new skills and strategies to live successfully day to day with a brain injury. Next slide, Beth. We also know that this is true for people who commit acts of domestic violence. And so in the broader system, they're often referred to as batterers. This is important as well for people who are batters to make sure that we're adjusting their treatment to be responsive to the brain injury and their day-to-day symptoms so that they can more successfully engage in treatment. Treatment is responsive to them, and they can more successfully adapt the skills to get their needs met in a healthy way when they're in a relationship, rather than using coercion, abuse, and control to get those needs met. While their rates are not as elevated as their partners' rates are, their rates are still much higher than that of the general population. We know in the general population, we're looking at about 18 to 25% of people have had a brain injury. When we isolate the domestic violence batter population, they have very similar rates to that of the broader criminal legal system setting. So in a probation or community corrections field, we might see about 45 to 55% of people are living with brain injury, and then that continues to get higher the more restrictive the carceral setting is. Next slide, Beth. This is also really important to pay attention to, and for us to, as a field, be really responsive to, because brain injuries affect the entire family system. If you've ever had a brain injury, it makes parenting more difficult. We know from our colleagues in Iowa, they are screening parents who are referred to child welfare, and they screen parents of child welfare cases when there's domestic violence, substance use, and mental health concerns in the home. When they screen the parents, they have very high rates of brain injury findings. We're looking up north of 90% of the parents screen positive for lifetime history of brain injury. We also know that brain injuries can make treatment more difficult if they're unrecognized, and that there's a lot of comorbidity between brain injury, substance use, mental health disorders, and trauma. And so when we're really trying to make sure that we're being brain injury informed in our treatment approaches, being responsive to trauma and substance use and mental health is hard enough, but we'll constantly be swimming upstream if we haven't screened for and properly identified not only the brain injury, but how is it causing complications in a person's day-to-day life and in how they're able to engage in and participate in treatment. And then finally, no matter who it is, whether it's the batter or the victim, brain injuries and having a brain injury can make it really difficult to engage in services. So when victim services go along with police to domestic violence calls, and they rattle off a bunch of information and drop some pamphlets on the table and leave, that's a lot of information that is hard for a victim to understand and absorb in that moment. Same thing when we have a batterer in our office or a probation officer. We rattle off a bunch of information and say, here's your terms and conditions. This is what you have to do to get off probation, and here's your next appointment. That can be really hard for somebody to absorb that amount of information and show up ready to engage in behavior change at their next appointment. Beth? So why are we doing this now? Well, Beth and I have independently been working on this in our separate states and in separate little pockets. And we knew, and other state administrators all knew, that this is something that is really important to us collectively. We work with partners in the community who focus on intimate partner violence and domestic violence. There has been a lot of raising awareness about the importance of brain injury in those sectors. We just all attended, a bunch of us just were in a webinar with our colleagues from Ohio focused on brain injuries and domestic violence. And so we've known that it's happening in pockets, but it's becoming more of a groundswell of late. And I had submitted a request to run a special interest group, and Haley emailed me back and said, "That's cool. You know that you get to do this, right?" So I was like, "Oh, great. Okay, well, let me find some help." And Beth and I were on a webinar with a bunch of other states who were doing this work. And it was a request of our colleagues in North Carolina to learn what is happening in other states to screen domestic violence survivors living in shelter settings. And while we were in that meeting, Beth and I were chatting back and forth, and Beth said, "Yeah, I absolutely want to do this." So we reached back out to NASHIA and said, "Yep, we're ready. We are ready to kick off this special interest group," and we got permission to do so. So that's where we're at now. We want to make sure that we're using both the national attention, the national recognition of this being something that we should be paying attention to, and the local expertise to create and learn from our collective experiences and wisdom to figure out what are best practices for people when it comes to working in any sector or section that works with people who are involved in the intimate partner violence or domestic violence system, to screen for brain injuries and provide brain injury informed accommodations, resources, and adjustments to treatment as usual. That.
Awesome. Thank you. All right, so now what? So we recognize that this is such an important topic, and based on all of that stuff that Russha just talked about, that we decided that as professionals, we needed a space to come together and share notes and start working towards some best practices. As Russha mentioned, she'd been doing some work in Colorado. I had been a part of some work here in Missouri. It was one of those things. I attended the virtual NASHIA conference back in 2021. That was my first exposure to the NASHIA community. And I sat in on a one of the sessions that was about intimate partner violence and brain injury. And it was just such an aha moment of like, this is something that there is a high incidence within this population. This is something that needs to be targeted. These are individuals who wouldn't otherwise be connected to our systems. And now that we've established partnerships in Missouri with our Coalition Against Domestic and Sexual Violence, and I've been doing trainings within domestic violence shelters, it's the same response every time. It's kind of that aha, like, yes, this makes so much sense. Those clients weren't just difficult or didn't want to participate. They genuinely likely had brain injuries and limitations associated with those brain injuries. And I've had so many advocates tell me, had I known what I know now when I was working with those individuals, I would have changed my approach and they may have been more successful. So it's a lot of that, you don't know what you don't know. And so building awareness is a big component of what we plan to do here. So we've established the IPV SIG and established this really important topic. And you guys also recognize this because otherwise you wouldn't have prioritized this. And obviously we have 93 individuals here. So I love all of the participation and coming to hear about this. So we've kind of put together a version of our mission statement. And I'm also going to kind of talk a little bit about how we anticipate the structure. But this is kind of fluid. Russha and I are co-chairing this, but we want it to be collaborative. We want to get input from our members. And so this is just a starting point, and it'll continue to evolve as we work together. But our mission as of September 4th is to bring together brain injury and IPV experts to develop and advance best practices for brain injury identification, support, and care across IPV settings. So obviously we really want to have a lot of representation from brain injury world, but also we want to have those different perspectives from the criminal legal system, from domestic violence, from IPV, and so forth. We've also established, we have 9 goals of this group. We dream big. Maria's going to drop those in the chat. They're a little bit lengthy, so I've summarized them here. You can review them on your own, and we can send them out on the follow-up email as well. But this kind of encapsulates those 9 goals. So really, we want to be focusing on building capacity, establishing best practices, and developing resources. So we envision this SIG to be a working group. We definitely want to have that learning collaborative component of coming together, sharing and learning from one another, but we also want to have research and resource development components as well. So if we end up having a very large group, we're definitely going to have subcommittees. And so those are some different potential avenues for this group. The second kind of high level is strengthening awareness and collaboration. As I mentioned, it's one of those things where when you bring the attention to it, it makes so much sense. It's just people aren't always thinking of that, especially if you are in the IPV world. You're not always thinking about brain injury until you do. And one of our partners, she jokes, she's like, you just can't unsee it. It's once you hear about it and you think about it from this brain injury informed lens, you can't think about it any other way. So awareness and collaboration is really important. And then the last being expanding to improve brain injury screening within IPV settings. So we will be doing obviously some systems change work, some big picture stuff, some national best practices work, but screening for brain injury is such a large component of that awareness and knowledge building. And so that's also going to be a part of this as well.
Hey, Beth, before you go on, Maria just let me know we have a couple of questions. And so,
okay. Yeah.
Yeah.
Sure.
Awesome. You want me to unmute people?
That'd be great.
Sure. Do they have hands raised, like they want to be unmuted?
They do.
If they want to be unmuted, I would like to unmute them.
I see Kelly Sarmiento has a hand raised. Kelly, can you unmute yourself now? And Paul. And looks like Zeta. And if that doesn't work, it should work for you. If that doesn't work, if you want to just put your question in the chat, we can read those out. I heard a voice.
I think that was me.
Okay. You should be able to unmute yourself. All right, maybe not.
All right, if you want to just throw those in the chat, I will go through the focus and then we can answer the questions if that's good. Okay, so our focus populations, because IPV, intimate partner violence, domestic violence, I mean, there's a lot of terms that are out there. There's different terms that are used in each state. And so we just wanted to kind of take a minute to, because as co-chairs of this group, we've had a lot of discussions around this, and we really want to cast a wide net and include a lot of the populations, but also keeping it in violence-based. So we've kind of broken it up into 3 categories. So the first being survivors, victims. Again, they use different terms in different states, but that essentially we're including self-advocates, individuals who have lived experience, people who are in shelters, family justice centers, and so forth. The next area that we want to focus on is batterers or abusers. Like Russha mentioned in her section, there is individuals who are abusers or batterers also have a high incidence of brain injury. And our hope is that if we can identify that and help have their needs be met, that potentially reduce further abuse in the future. So this is why that's another population that's important. And then community partners, so courts, victim services, probation, parole, therapy, even within employment and things like that. So making sure that they have knowledge, awareness, and can also provide brain injury informed practices. All right, was that enough time? We have all of our questions lined up now.
I'll keep answering them if you want to keep going.
Yep.
Oh, okay. All right, perfect. All right, so the proposed structure of the IPv6. So again, as we mentioned, this is just, we've kind of put this together to get our thoughts organized and kind of put out some ideas of how we want this to look. But it's going to continue to evolve as we work together and get input and such from our members. But the first area that we want to focus on is those priority areas. So we want to hear from states. What are the needs and what's happening in your state? What needs to be addressed? What are those priorities? And that way we can also identify short-term and long-term goals and high impact and low-hanging fruit, as Russha says, so that we can kind of help identify some of those things. So that's our first. The second is establishing those subcommittees. So as we mentioned, we anticipate this being somewhat of a large group, maybe larger than we originally thought, but there'll be some different interest areas. I know we're already kind of funneling down when we're thinking brain injury and intimate partner violence and then going further, but I mean, subcommittees could be things around legislation. They could be things about product development. They could be research and so forth. So we can kind of once we know what our priorities are as a group, we can kind of break those up into smaller subcommittees with manageable chunks and kind of those goals identified with each of those. And then from there, the committee work will happen, and those committees will create their recommendations based on kind of whatever those goals are. And we are some researchers, and so the peer review of the recommendations. So subcommittees will review other subcommittees and make sure that they're high quality and that they meet what we're looking for as far as those recommendations. And then from there, we'll submit them to NASHIA for final approval, dissemination, and so forth. And then we'll share them out nationally. So yeah, that's what we hope to achieve. All right, Russha.
So I talked a little bit earlier about what we know about data and prevalence rates and all that fun stuff, but there's a lot that we don't know as well. We don't know what are the best practices for implementation. We don't understand exactly how should domestic violence treatment programs that are working in the battery intervention space specifically be adjusted to address brain injuries that were caused during childhood. And is that different for brain injuries in adulthood? Excuse me, there's a whole bunch of stuff that we don't know. But we also know that we don't have to do this alone. There's so much collective expertise just actually on this Zoom call right now, that really what we're hoping the SIG will do is be able to pull that collective expertise together. And so knowing that there's so much we don't know, we want to open a quick poll. And as a part of that poll, we want to ask all of you, where and what intimate partner violence settings in your states is screening for brain injuries happening right now? Maria, can you open the poll for us?
Sure. And first, though, we want to know what state you're in.
Thank you.
And we have also options for I'm not sure, for none, if you aren't sure kind of what's happening in your state within this space. This is just kind of quick for us to take a pulse.
So while people are voting, I'm going to start tagging on some of these questions that are coming through the chat. And I know there's some coming through the Q&A, and I'll get to those as well. Kelly asked a question about what the time commitment involves to be a member of the SIG. We're assuming that we're going to meet quarterly for 60 to 90 minutes, and then subcommittees will meet in the in-between months. But without knowing exactly how many people are on the SIG, we're not 100% sure yet. But I would guess 60 to 90 minutes a month would be the commitment that SIG members are making. Scott, I'm paying attention to the poll as well. So Maria, you just interrupt me when the poll's closing.
There you
Scott
go.
asked about who to contact for subcommittee ideas and membership.
Russha, I'm interrupting you. I'm sorry.
Nope, it's okay. I see it. Thanks, Maria.
Okay.
Membership goes to NASHIA, and Haley is the membership coordinator, and subcommittee ideas can come to Beth and myself, and I'll make sure that we put our email addresses in the chat. So there is so much screening already happening, although the number one answer is I'm not sure. And that's fair. We didn't ask anybody to come prepared with these answers today. But it looks like a lot of states answered screening is happening in domestic violence shelter settings, probation and parole community supervision settings, correctional settings, and outreach programs, and advocacy. So there's a lot of great screening already happening. That's fantastic. That's really great. Okay. So we want to hear from you. This SIG, well, like Beth said, it's not going to be Beth and I. We're just creating a format to bring all this expertise together. And so what we want to hear from everybody is, what are your priorities for this kind of initiative? What brought you here today? And if you were to join the SIG, what would your priorities be that you're bringing to the table? And I think people maybe cannot come off mute. Maria, is that where we're at?
That may be where we're at. So
Okay.
if you guys don't mind, just putting questions in the Q&A or the chat for us.
So go ahead and answer this question specifically in the chat about what are your priorities for this kind of initiative, and Beth and I can, we'll read them for you guys and speak to them a little bit.
I think I may stop share just so I can see the chat.
So one person put in educating staff would be their priority. Another person put in connecting the brain injury informed work we're doing in probation with various IPV partner settings and agencies. Keith shared that he would like to see better outcomes. Oh man, there's so much stuff coming in. It's so great. Rachel shared a wider awareness of complexities of doing this work in the context of domestic violence. Harley shared to get IPV agencies to screen universally for brain injuries. Yeah, that's a major priority, right? Just screening would help so much. Kim shared that her TBI council has prioritized this as a topic or an issue. Peggy shared that she would like to see the SIG develop some universal tools so that we don't have to reinvent the wheel. Yeah, absolutely.
I know that was talked about a lot in the last session, in the brain injury violence related session we were on right before this.
Yeah, with Ohio Domestic Violence Network. Ashley shared consistent screening practices across agencies. Brandy shared screening and awareness would be helpful. And really that screening is so important because if you ask people directly, do you have a brain injury? They'll so frequently say, no, I don't have a brain injury. And it's because people aren't properly diagnosed. And there's so many misconceptions about what a brain injury actually is. We were just talking this morning about how more than 80% of people think that concussions are not a brain injury. When we're working within the domestic violence field, we also know that strangulation causes anoxic brain injuries due to a loss of oxygen to the brain. And so people who have been involved in violent relationships often are living with both non-traumatic and traumatic injuries. Another person shared that they would like to use this information to help prevent repeat offenses. Absolutely. This is, again, a family systems intervention because cycles of violence can go from one generation to the next. And if we can interrupt that now, that means that the next generation won't continue to choose to use what was modeled for them in relationships. Emma shared improving access to care and treatment options. May said that they're already requiring screening in their standards. That's so great.
This
Kelly
is all
shared
really great feedback. It sounds like we could probably pull out some themes already on some of this stuff. This is awesome.
yeah,
There's
more
also
about creating tools. Yeah, this is fantastic. Where to send people for help. Thanks, May. Less
Yeah.
stigma, consistency in screening and education. This is fantastic.
Yeah.
Wow.
Also, I see
Okay, there's so many
needs for
answers. There's no
rural
way we can get
communities.
through all this.
This is awesome. Yeah, and keep on coming. I mean, we're going to save the chat and we can kind of, yep, I see another one about rural communities. So many of our states have those, those very urban areas. I know Missouri has that. And then there's rural everywhere in between.
You guys have a great question in the Q&A that I think really would be good to respond to for the larger crowd from Paul. Can you see it?
Yeah, I was just reading it. Thanks, Maria. Paul, who actually, prior to being in brain injury, I worked in the criminal legal system setting for a long time. And one of my mentors in that space, David Garvin, is here. I'm so happy he's here with us. And one of my colleagues who also taught me so much about domestic violence and effective treatment for people in battering intervention programs asked this question. Paul said, I'm in the abuse intervention world and not part of any state brain injury work, but I'm very interested in making brain injury awareness part of DV intervention. I work nationally with abuse intervention providers. How might I or we relate to this new group? Paul, we are so hopeful that we will be able to have lots of DV and abuse intervention providers join us for this work. Our goal is that we're bringing together and taking a multidisciplinary standpoint on all the development of this, and you have an equal seat at the table. It is not brain injury dominated by any mean or in any respect at all. The reality is that we have so much to learn and hear from our domestic violence provider and abuse intervention partners. It's there's no way we can do it without you. So if there's anything that we can do to come and speak with partners nationally and invite them to the table, we would love to have you. It's everything that you guys will join us. And if we can't have you at the table for any reason, our intention is to find new pathways to be able to bring things for feedback and input as we continue to develop products, especially as it relates specifically to the abuse intervention and battering intervention program sectors. I hope that helped.
Definitely.
Okay.
All right. Were there other questions? So we have space at the end too for more questions, but was there anything kind of related to priorities? Okay. All right. So now that we've gotten you all excited, so those that were curious came in and curious about the IPB SIG and now want to register and be a part of it, we have a QR code that you can sign up. There's also a link. Maybe Maria or Jill could drop that, or Russha drop that in the chat too as an opportunity if you wanted to, if you're ready to just jump in. We definitely want to work together, taking small steps to make a big difference, and just see where this takes us. We also wanted to highlight that at the State of the State NASHIA conference, we will be offering an in-person meeting. That'll be on Monday morning, so right before the conference kicks off. This is just an option. It's not required, so don't think that if you miss out on this meeting that you can't be part of this group. It was just an opportunity for us coming together, and so we wanted to allow for that. So some of the things that you can expect in the in-person meeting. We're going to talk more about the goals for our SIG, establish those priority areas, so kind of have some discussions and some interactive things. Russha and I have been thinking about how we want that to look as far as interactive components to discuss those priority areas, and then starting to establish some of those subcommittees. And having some facilitated activities. So hopefully if you will be in Maine, we would love for you to join the in-person meeting.
We'd love for you to be at SOS period. We have some excellent content that's going to be there. And one of the plenary sessions is focused on intimate partner violence. Rachel Ramirez, if you're still on, and Sandra LeClaire and Lucy Cordwell are going to be there presenting. And so you won't want to miss that. Come join us.
Please do. And if I don't already know you, please make sure to introduce yourself at the conference. Anything else you want to say about the conference? Registration link is here.
I'm just trying to think. There'll be a lot there on screening, and we have talked a lot already about screening across a lot of settings. And as you know, brain injury crosses into a lot of other settings. So does intimate partner violence. So you may want to hear about those other settings, criminal legal system, behavioral health. There's a lot there for you to learn about. We think it's a fabulous conference. We're a little biased, but we'd love to have you.
Awesome. Thanks, Maria. So we'll have some time for questions. Here's all of our contact information. Again, Russha and I are the co-chairs. Maria and Jill are NASHIA sponsors and mentors and helping guide the work that we're doing here. And so we'll just open it up. What else can we chat about around this topic, and what other questions or anything else that we may have missed? And thank you for adding those links to the chat.
One question that we just got that I answered was whether the in-person meeting will be open to be held hybrid as well. And I responded, no, it's for SOS attendees, but that we will not make any major decisions without the rest of the SIG getting to have a chance to have input. Maria, I'm getting a lot of questions around NASHIA membership requirements. I don't know if you want to speak to that again.
Sure. Or if Haley wants to, either one of us could. There's Haley.
Sorry, I'll look through the chat, and if you want to go on to another question to see what those questions around membership are, and come back to me.
I guess generally speaking, while we would love to waive all the membership dues for everyone,
Yes.
so that everybody could be a NASHIA participant in all things, we do have a lot of costs.
This conversation with
Oh, go ahead.
I think Paul was now unmuted, and so we were hearing some of his background noise.
Oh, okay.
Go ahead, Maria. So we would love to be able to waive everybody's
We
membership.
would love to be able to do that, but we cannot do that because we have, a lot of expenses that as an organization, a national organization, we have to meet. And I would bet that my boss, our executive director, would concur with that. So unfortunately, that's something that comes along with participating in a special interest group. And then I guess Haley will answer any specific questions that you guys may have within the chat. Anything you want to add to that?
Thank you, Maria.
I would add in just membership to NASHIA has other benefits. I know Haley had highlighted some of those at the beginning. And so if the SIG is your entry into NASHIA world, I mean, it's definitely an amazing community. I feel like it's been helpful for me professionally, and just having this community that is very willing and eager to share information. And I've reached out to so many other states, like, here's an issue that I'm having. How have you resolved this in your state? And also paying it forward. Other states have asked us questions as well. So it's just this really great community. I don't know if Haley, you have anything else you wanted to add?
We do provide a lot to our members, or we feel like we do, in terms of training and education and resources, and connecting the dots between federal and state programs and policy and advocacy. So it is a lot more than just participating in this, which we feel like is going to be pretty big. There, I see more in the Q&A. Are there some other questions there we need to answer?
I know, Maria, somebody put in that they weren't able to access the presentation in the chat. They weren't able to pull down the PDF. So how can they get that?
You can email me and we can send that out.
Okay.
Let me pop well, you've got my email address, but let me share it again. I will be happy to send it to you.
Thanks, Maria.
Sure.
I would also say there's so much happening in the chat about we're doing this in our state, and we're really hopeful that you'll join the special interest group to share that and have the work that you're doing go to benefit other states and to be elevated nationally, so that it's used to help create a benchmark and guidance about how to best screen for people in all of these settings. Oh, we have people wanting to come off mute. Christy, do you want to go first?
Or Sandra.
Well, whatever Paul did worked.
I am unmuting you guys. It just says, that I can ask you to unmute. So on your end, if you can unmute yourselves, you should be able to talk.
Christy and Sandra, if you guys want to ask your questions in the chat or the Q&A, that will work too. But if you want to unmute, we're here for it. What other questions do people have? We have about 4 minutes left and we're here for all 4 of them.
And we do have another special interest group. This is not the only one that we have. There's one on children and youth. So NASHIA will probably continue to add other special interest groups as well. So you can always send questions our way too.
Anytime.
How can you engage with the other SIG? I believe Jill just put the SIG page on there. So you can click on that and you can take a look at all of the, it's the NICB SIG. And they do an annual presentation for NASHA through our Training and Education Committee. They did a presentation in January, our webinar. And so that should be on the NASHA training page as well if you wanted to learn a bit more about what they have been doing and kind of get an overview of their work. All right, we just have a couple more minutes. If there's other questions, definitely feel free to drop those in. Feel free to reach out to us at any time. But I just wanted to take a minute to say thank you so much for your interest and really wanting to talk about this such an important topic and establish these best practices and come together. And we hope that you will join and we can see where this takes us, especially since so many of you guys are doing such great work within your state to really kind of share out and compare notes. Oh, thank you, Ashley.
All right, with that, you guys have a fabulous afternoon.
Awesome.
Thanks, everybody.
Thank you
Thank
so
you all.
much. Appreciate your time.